for being here today. We're Team 6, and we're thrilled to introduce you to FormEase, a healthcare app designed to bring simplicity, clarity, and efficiency to one of the most frustrating parts of the medical experience, the patient check-in process and the aftercare management. I'm Caitlin Keefe, and alongside me today is the brilliant minds of our leadership team, Adam Haney, Brett Holt, Amanda Roa, and Kirsten Nicole. We're excited to show you how FormEase is going to transform the patient experience. Thank you. FormEase isn't just another healthcare app. It's meant to be a smart companion app meant to work simultaneously with existing EMR systems like MyChart. It's meant to solve a major problem with their systems, the outdated, manual, error-prone check-in process. And also, while most of the healthcare systems focus only on clinical care or record keeping, FormEase tackles the first mile and the last mile of the patient journey, streamlining check-ins, but also making sure that patients walk away with the information that they need clearly and accessible. Brett's going to dive more into our product details later, so just wait around a little bit. Now let's be honest. We've all been told to arrive 20 minutes earlier to a healthcare appointment, only to fill out paperwork that we've already seen about a dozen times before. This isn't just inefficient, it's also inaccurate, frankly, just a waste of time and resources. And then finally, you get to see your doctor, but the time is so brief, and then by the time you get to your actual car, you've already forgotten all the details that they gave you. Now, this is not just anecdotal. Studies show that 40 to 80% of patients forget key medical advice immediately after a visit. Now, this is a massive gap in the healthcare industry, but a massive opportunity for us. FormEase bridges this gap, bringing automation, clarity, and continuity to the patient experience before, during, and after the appointment.
FormEase is the smarter way to manage patient check-ins and post-visit engagement. Our healthcare app digitizes and automates the entire process, eliminates paperwork, slashes administrative costs, and minimizes costly errors by working alongside existing EMR companion apps like MyChart, all while creating a better experience for our patients and staff. From any location, patients have the ability to securely upload medical history, insurance cards, and fill out patient forms or questionnaires. It will require data to be updated at least once a year to prevent outdated information, and FormEase will have features such as direct messaging with providers, using AI capabilities to understand test results, and manage and pay bills all from their cell phones. We do use secure healthcare systems to give all users a top-notch experience. We do want to be clear that we are not a complete overhaul of current EMR systems, but simply an enhancement layer for them. So we do think that there are good market opportunities right now. Our total available market is around 7,400 hospitals in the US, plus roughly another 1.1 million active physicians in the US. The serviceable available market that we want to target are the smaller hospital healthcare systems and physicians' offices. The share of the market that we're likely to reach are the healthcare systems locally in Arizona to start. And in 2021, a study showed that 96% of hospitals and 78% of office-based doctors have EHR systems. While that information is a little bit outdated, it does tell us that there are plenty of networks with EHR systems that FormEase can supplement. There are more than enough opportunities for us to work in.
We're targeting independent clinics and urgent care centers, especially those already using MyChart or similar EMRs, but frustrated by the rigid intake workflows. FormEase works with existing systems, so we're not asking clinics to rip and replace, but to enhance what they already use. Our customer acquisition strategy focuses on direct outreach to office managers and IT staff, offering a free pilot program that transitions to a low monthly subscription. We're building awareness through demos, healthcare expos, and partnerships with provider associations. To address the challenges of staff adoption and system integration, we provide hands-on onboardings, customized training sessions, and dedicated support for EMR integration, ensuring a smooth transition without disrupting existing workflows. Unlike MyChart, which locks clinics into present forms, FormEase provides easy customization and integrates through a plug-in model rather than a platform overhaul. We also solve a key pain point, ensuring patient data stays up to date by automatically prompting patients to review and update forms before every visit, something MyChart and paper forms don't do. Our competitive advantage comes from reducing admin errors, enhancing patient engagement, and minimizing staff disruption. We're committed to supporting clinics through the transition with dedicated integration and compliance support, so they can adopt FormEase confidently without sacrificing data security or workflow stability.
We're launching in Tucson, where demand is already validated with interest from major hospitals and mid-sized clinics. This isn't hypothetical. Our cold outreach is converting, and we've built a referral program targeting early adopters. Our founding team brings unique dual insight, having experienced frustrations on both the patient and admin sides, which gives us an edge in solving real pain points. Our AI-driven summaries and seamless EMR integration directly address gaps left by legacy tools like MyChart. Plus, we're strategically rooted in Tucson's growing tech ecosystem and backed by the University of Arizona, giving us access to talent, research, and strong community momentum. We're raising $100,000 for 10% equity, valuing the company at a $1 million post-money cap, well within range for early-stage software services. We project $420,000 in year one revenue with lean expenses of just $100,000, resulting in a gross profit of over $300,000. Our revenue model is scalable and sticky, monthly B2B subscriptions that rise post year one, discounted annual plans to boost retention, and optional AI-powered add-ons like smart scheduling and advanced analytics. This funding will directly fuel growth, expanding our clinic base, refining our product, and accelerating us towards profitability in future funding rounds.
Hey, I just wanted to take the time to formally introduce the entire team here at FormEase. I'm Adam Haney, one of the co-founders and lead designers. Have lots of experience in software engineering, data collection, data science. I've worked at a law firm in accounting for over 2 years and as a systems administrator and software engineering intern. I plan to develop the UX and the UI for the FormEase platform and on the App Store and integrate the data collection and the software through my understanding of data and my knowledge of coding, specifically in Python and JavaScript. Also, our CCO, Brett Holt, he brings lots of experience in leadership and planning. He's going to be responsible for all the commercial aspects of the company, such as sales, marketing, and future market growth. He's going to find great ways to bring more additional profits and revenue to the company. Next up is Caitlin Keefe, our COO. She brings a strong foundation in accounting and operational leadership. Her career so far has been rooted in healthcare and nonprofit sectors, pretty aligned with our company's industry. She has lots of experience managing complex budgets, optimizing internal processes, and leading cross-functional teams. She acts as the leader to our company, essentially. Next up is Kristen Nicole. She is also a co-founder and the CEO of the company. She holds an associate's in criminal justice and has many years of hands-on experience working as a pharmacy technician. She definitely has a direct insight into healthcare technologies, pharmacy workflows, and patient-facing processes. She's also very well versed in HIPAA laws and compliance protocols, ensuring our patient information security remains a top priority and doesn't get leaked or violate any guidelines. She's going to lead the vision and the operations and the strategic partnerships, ensuring that it's going to meet the real world needs and not just the conceptual needs that we have for the product. Lastly is Amanda Roa. She is the CFO. She will be responsible for overseeing the finances, including our budgeting, our financial forecasting, tracking our spending, and maintaining accurate bookkeeping. She's also going to manage investor relations and ensure the company's long-term financial sustainability.
Our latest presentation delivered strong results and clear traction. Audience interaction hit 65%, with smaller clinics showing especially high engagement, indicating strong early adopter interest. Knowledge retention came in at 72%, giving us a solid foundation while highlighting opportunities to refine how we communicate technical and AI features. We scored an average of 4.3 out of 5 in post-session surveys, showing high perceived value despite some questions around integration, something we're actively addressing. Referral rates reached 15%, signaling organic momentum, and we've already identified 10 partnership opportunities that position us well for broader strategic growth. The feedback is actionable and the interest is real.
Hey, I just wanted to thank you for listening to our presentation on FormEase. If anyone has any questions, myself or the team are glad to answer any concerns or clarifications you may have. Thank you again for watching.